Chapter 11 Principles of Pharmacology. Medications are an important intervention available to you as an EMT. When used appropriately, medications may alleviate pain and improve a patient's condition. Failure to administer medications safely and competently can lead to serious consequences for the patient, including death. As an EMT, you will administer medications, help patients self-administer medications, ask patients about medication use and allergies, and report patients' medication information to hospital personnel. How medications work. Medical definitions. Pharmacology. Pharmacology is the science of drugs, including their ingredients, preparation, uses, and actions on the body. Medication, the definition, is a substance used to treat or prevent disease or relieve pain. Pharmacodynamics is the process by which medication works on the body. A medication can either increase or decrease a normal function of the body. All right. Your terminology. An agonist is a medication that causes stimulation of receptors. An antagonist is a medication that binds to a receptor and blocks other medications or chemicals from attaching there. Dose, that is the amount of medication that is given, which depends on patient's weight, patient's age, and desired action of the medication. An action is the therapeutic effect that a medication is expected to have on the body. An indication is reason or condition for which a particular medication is given, or a contraindication is when a medication would either harm the patient or have no positive effect. Absolute contraindications is when the medication should never be given, and relative contraindications is when the benefits of administering the drug may outweigh the risk. Side effects. Any action of medication other than the desired one. Unintended effect is the effects that are undesirable but pose little risk to the patient. And untoward effects are effects that can be harmful to the patient. You definitely need to know all of those definitions. Medication names. The generic name is simple, clear, non-proprietary name. Generic names are not capitalized. The trade name is a brand name that the manufacturer gives to a drug. Examples: Tylenol, Lasix. Trade names begin with a capital letter. One drug may have more than one trade name. Prescription drugs are distributed only by pharmacists and require a physician's order. Over-the-counter drugs may be purchased directly without a prescription. Other kinds of drugs, recreational drugs, heroin, cocaine, meth, herbal remedies, enhancement drugs, vitamin supplements, any medication that a patient takes can be pharmacologically active and can cause an effect. So ask patients about any and all medications or drugs they are taking. Routes of administration. Internal medications enter the body through the digestive system, often in pill or liquid form, such as a cough syrup. Medications administered via this route tend to be absorbed slowly and are not commonly used in an emergency setting. Parenteral medications enter the body by some other means, often in liquid form administered through needles or syringes, and they are absorbed more quickly and offer a more predictable and measurable response. Absorption is the process by which medications travel through the body tissues to the bloodstream. All right, routes of administration. Per rectum, which is by the rectum, easy to administer, and it provides a reliable absorption. Oral, or PO, which means by mouth, enters the bloodstream through the digestive system. It takes as long as an hour for absorption to occur. Intravenous injection, which means into the vein, it's the fastest delivery but cannot be used for all medications. Interosseous injection into the bone reaches the bloodstream through the bone marrow, and it requires drilling a needle into the outer layer of the bone. This is also known as IO. Subcutaneous injection means beneath the skin. Injection given into the fatty tissue between the skin and muscle. Intramuscular injection, it's just that, into the muscle. Usually absorbed quickly, but not all medications can be administered by the IM route. One example of an IM drug would be like an EpiPen. Inhalation, that's where it's breathed into the lungs, absorbed into the bloodstream quickly. Forms include aerosols, fine powders, and sprays. Sublingual, under the tongue. It enters through the oral mucosa under the tongue and is absorbed into the bloodstream within minutes. Example of that would be nitroglycerin tablet. Transcutaneous, also known as transdermal, is through the skin. It's applied as a patch to the skin. It's longer lasting effect than other routes. And an example of that would be like a nitroglycerin patch or a nicotine patch. Intranasal is a relatively new format for the delivery of medication. The medication is pushed through a device called a mucosal atomizer device, MAD, that aerosols the liquid for delivery into the nostril. It has quick absorption. Some examples is Narcan or like flu vaccine. I even think they've come out with COVID vaccines now that are intranasal. The form of a medication usually dictates the route of administration. The manufacturer chooses the form to ensure proper route of administration, timing of the medication's release into the bloodstream, effects on the target organs or body systems. Tablets and capsules. Most medications given by mouth are in tablet or capsule form. Capsules are gelatin shells filled with powder or liquid medication. Tablets often contain other materials that are mixed with the medication and compressed. Solution and suspension. Solution is a liquid mixture of one or more substances that cannot be separated simply. Solutions can be given by almost any route. When given by mouth, solutions may be absorbed from the stomach fairly quickly because the medication is already dissolved. Many solutions can be given as IV, IM, or subcutaneous injections. The suspension is a mixture of finely ground particles that are distributed evenly throughout a liquid by shaking or stirring, but do not dissolve. Suspensions separate if they stand or are filtered. It is important to shake or swirl a suspension before its administration. Metered dose inhalers. These are liquids or solids that are broken into small enough droplets or particles that they may be inhaled. A spray canister directs such substances through the mouth and into the lungs, delivers the same amount of medication each time it is used, often used for respiratory illnesses such as asthma or emphysema. Topical medications, they include lotions, creams, and ointments. They are applied to the skin surface and affect only that area. Transcutaneous medications, they're also referred to as transdermal medications. They are absorbed through the skin, and unlike topical medications, which affect only the intended site, many transdermal medications have systemic whole body effects, such as a nitroglycerin paste or a patch. If you touch the medication with your skin, you will absorb it just like the patient. Gels, they are semi-liquid, administered in capsules or through plastic tubes. Example is the oral glucose for patients with diabetes. Gases for inhalation, usually delivered through a non-rebreather mask or nasal cannula. Oxygen is the medication most commonly used in gas form outside the operating room. General steps in administering medication. Medication should be administered only under the authorization of online or offline medical direction. You have to follow the 6 rights. And I will interject here that you need to know this. It is very important. The 6 rights are as follows. The right patient. You must ensure that the patient who needs the medication is the patient who receives that medication. Right medication. Verify that the proper medication and prescription is what you're giving. Right dose. You're going to verify the form and the dose of the medication. Right route. You're going to verify that route of medication. Right time. You're going to check the expiration date and condition of the medication. And right documentation. You're going to document your actions and the patient's response. Medication errors almost always result from failure to follow the 6 rights. So right patient, right medication, right dose, right route, right time, and right documentation. Medication administration in the EMT. Over the years, EMTs have been allowed increasing responsibility to work with medications. Many departments have strict guidelines on when an EMT is allowed to administer a medication. Peer-assisted administration. You administer medication to yourself or your partner, such as if you were exposed to a toxic agent. Patient-assisted medication. You assist the patient with administering his or her own medication. Examples would be nitroglycerin, a metered dose inhaler, an epi auto-injector. EMT administered medications. The EMT directly administers the medication to the patient. The patient may be severely confused or unable to understand the need for the medication. Examples would be oxygen, oral glucose, or aspirin. Medical control state guidelines and local protocols determine what an EMT in your system may administer. Refer to your local standards to obtain a listing of how and when EMTs can administer medications. All right. Medications used by EMTs. Um, Oral medications. Your considerations, the advantages is ease of access, but the disadvantages is the digestive tract can be easily affected by food, stress, and illness. Activated charcoal. That is one of your drugs. Many poisonings involve overdoses taken by mouth. Activated charcoal reduces the amount of medication being absorbed by the body by binding the drug to its surface. That is adsorption. Frequently suspended with sorbitol, which is a sugar, it has a laxative effect that causes the medication and the charcoal to move quickly through the digestive system. It is administered by mouth and it may be appealing to patients, so use a covered container and ask the patient to drink the fluid through a straw. It may stain clothing and should not be given to patients who have an altered level of consciousness because of the risk of aspiration or have ingested an acid, an alkali, or a petroleum product. And remember, activated charcoal is a national registry allowed drug for EMTs, but the state of Alabama does not allow us to use activated charcoal. All right, oral glucose. Glucose is a sugar that cells use for energy. It is necessary for brain cells. Hypoglycemia is extremely low blood glucose. Oral glucose can counteract the effects of hypoglycemia. An EMT can give glucose only by mouth. Available as a gel designed to be spread on the mucosous membranes between the cheek and the gum. Available also are glucose tablets, but you never administer oral medications to an unconscious patient or one who is unable to swallow or protect their airway. It reduces fever, pain, and inflammation. It inhibits platelet aggregation, which is useful during a potential heart attack. Contraindications is hypersensitivity to aspirin, pre-existing liver damage, bleeding disorders, and asthma, and it should not be given to children. Sublingual medications. Considerations. The advantages of sublingual medications is the absorption is relatively quick. It's easy to talk with awake and alert patients and advise them to place a pill under their tongue. The disadvantages is that they should not be used if the patient is uncooperative or unconscious, and any medication placed in the mouth requires constant evaluation of the airway. Nitroglycerin. Many cardiac patients carry fast-acting nitroglycerin to relieve angina pain. Nitroglycerin increases blood flow by relieving the spasms and causes arteries to dilate by relaxing muscles of the coronary arteries and veins. Also relaxes the veins throughout the body so that less blood is returned to the heart, decreasing workload and blood pressure. Before administration, you're going to check the patient's blood pressure. If the systolic blood pressure is less than 100, nitroglycerin may have a harmful effect. Even a patient who has adequate blood pressure should sit or lie down with the head elevated before taking this medication to avoid fainting. If a significant drop in blood pressure occurs and the patient feels dizzy or sick, have the patient lie down. Obtain a medical order or follow local protocols to administer nitroglycerin. It can have potentially fatal interactions with erectile dysfunction medications taken within the past 24 hours. So if a patient has taken Viagra or Cialis, um, Levitra, erectile dysfunction drugs may be used by both men and women. If a patient has taken any of those drugs, you cannot administer nitro. And if their blood pressure is lower, their systolic blood pressure is lower than 100, you cannot administer nitro. Intramuscular medications. The advantages is it provides quick and easy access to the circulatory system without the need of placing a needle within a vein. The blood flow to the muscles is relatively stable, even during circumstances of severe illness or injury. The disadvantage is the use of a needle and subsequent pain. Epinephrine, also known as adrenaline, is released into the body when there is a sudden stress. It is the main hormone that controls the body's fight or flight response. Sympathomimetic, it mimics the effect of the sympathetic nervous system. It increases heart rate, constricts blood vessels, causing increased blood pressure, dilates passages in the lungs, should only be given to patients who are experiencing a life-threatening allergic reaction. Epinephrine may be dispensed from an auto-injector. It automatically delivers a preset amount of medication, which is normally 0.3 milligrams. Some services do not permit EMTs to carry epinephrine, but do allow them to assist patients in administering their own epinephrine. Naloxone. It is used to reverse the effects of an opioid overdose. The most common technique for naloxone administration is via the intranasal route. Place the atomizer in one nostril pointing up and slightly outward. Administer a half a dose, which is 1 millimeter max, into each nostril. Inhalation medications. Oxygen, by far the most commonly administered medication in the pre-hospital setting. All cells, especially those in the heart and brain, need oxygen to function properly. It's generally administered via a non-rebreathing mask at 10 to 15 liters, and it's via a nasal cannula at 2 to 6. Must also provide artificial ventilations if the patient is not breathing, using a bag valve mask at 15 liters a minute. Ensure that there are no open flames, lit cigarettes, or sparks in the area in which you are administering oxygen. Meter dose inhalers and nebulizers. They're used to administer liquid medications that have been turned into a fine mist by a flow of air or oxygen. The medication is atomized and breathed into the lungs and delivered to the alveoli. The advantages of this is fast and relatively easy route to access, but the disadvantage is patient needs to be cooperative and control breathing, cannot be used for unconscious patients. Medications administered using an MDI. An MDI requires a great deal of coordination to administer. It may be difficult to achieve when a person is having trouble breathing. Use a spacer to avoid spray misdirection. A spacer fits over the inhaler like a sleeve. A spacer has an opening for the inhaler at one end and a mouthpiece on the other, and the patient sprays the prescribed dose into the chamber and then breathes in and out of the mouthpiece until the mist is completely inhaled. The only medication that this will be effective during an acute attack of shortness of breath are fast-acting rescue inhalers such as albuterol, Proventil, or Ventolin. Sorry. Patient medications. Patient assessment includes finding out which medication the patient is currently taking. This information may provide vital clues to the patient's condition. It may help guide your treatment, may be extremely useful to the emergency department physician, can help you determine a chronic or underlying condition when a patient is unable to relate his or her medical history. Discover what the patient takes and transport the medications or a list of them with you to the emergency department. Also ask about any non-prescription drugs such as over-the-counter, herbal, or illicit street drugs. Medication errors. A medication error is inappropriate use of a medication that can lead to patient harm. Ensure that the environment does not contribute to errors. Ensure that lighting is sufficient. Organize equipment. Limit distractions as much as possible. Consider using a cheat sheet to help yourself remember all crucial steps of medication administration. But if a medication error occurs, rapidly provide any appropriate patient care that is required. Notify medical control as quickly as possible. Follow your local protocols. Document the incident thoroughly, accurately, and honestly. Talk with your supervisor or medical director. It represents an opportunity to learn and identify areas to target during quality improvement. That concludes Chapter 11, Pharmacology. If y'all have any questions, please feel free to ask. If there's anything you need to be explained better or that you don't understand, please ask, get with us, let us help you. And as always, study hard and do good, and we'll see y'all Monday.